Hi, my name is LIM. I'm currently a postgraduate student in the Primary Care Department at University of Malaysia. This is my great pleasure to share with you my recent work recently published in the Journal of the American Heart Association.
Long-term visit-to-visit blood pressure variability and renal function decline in patients with hypertension over 15 years. In this study, we examined the relationship between visit-to-visit systolic blood pressure variability and decline in renal function in patients with hypertension, as well as to determine the level of systolic blood pressure variability that is associated with significant renal function decline. Our study shown that highest visit-to-visit blood pressure variability is associated with greater decline in renal function after adjustment for mean systolic blood pressure, and the estimated cutoff value for the onset of chronic kidney disease was 13.5 mm mercury for standard deviation of systolic blood pressure. We used a 15-year retrospective cohort study in a primary care clinic. It is clinically useful and relevant as it reflects the real-life changes of kidney function and the effects of blood pressure variability. For clinical purposes, we chose estimated glomerular filtration rate to study decline in renal function, as this parameter is readily available and inexpensive. Subsequently, eGFR slope was used to estimate the rate of renal function decline. To determine the level of systolic blood pressure variability that is associated with renal function decline, we used receiver operating characteristics curve and Yoden index. Look beyond the mean office systolic blood pressure. An apparently normal systolic blood pressure while on treatment for hypertension may still be associated with more rapid renal decline if the blood pressure variability is high. Our cutoff value of blood pressure variability in this study may be a useful guide for clinicians who are managing patients with higher fluctuations of systolic blood pressure. Efforts are needed to reduce the systolic blood pressure variability in order to slow down the loss of renal function. Thank you.